We've all heard of the opioid crisis, whether you've heard about it on the news, seen statistics about it on social media, or you have been affected personally by a loved one having an addiction. So, according to Wikipedia, the opioid crisis refers to the overuse, misuse, and overdose related to opiates or opioids. So, it's been affecting families since the 1990s, and it typically starts when people are prescribed pain medications, opiates or opioids for pain management, and then they become addicted. So, according to the CDC, in 2022, Rhode Island was ranked 17 out of 50 highest deaths in the United States. They've had 424 deaths per 100,000 people, but ranked 17 out of 50 is a lot. So as somebody who has personally been affected by the opioid crisis, I have family members who are still addicted and have been addicted in the past, and I feel like I have a good perspective on how it can affect families and loved ones, and I've also seen how difficult it is to overcome an addiction. So the opioid crisis has affected individuals and their loved ones for decades, and although the epidemic will probably never be completely solved, there are still many ways we can help minimize the problem. And although Rhode Island has implemented a lot of beneficial changes, there's still always room for improvement. So in today's speech, I will be expanding on the state regulations and policies that Rhode Island has implemented, the treatment options, and potential improvements that I have seen could be helpful. So according to the Rhode Island Department of Health, prescribers have regulations when prescribing opioids. So a full physical examination and health history needs to be done to identify substance abuse history and to also see if the individual's pain level is high enough to need an opioid. So there's a lot of different tools that can be used to help screen. There's a drug and alcohol screening tool and an opioid risk tool. So it's just a series of questions that the doctor or the nurse can ask patient, and it can help them identify whether or not the person is well enough to be able to handle it. The prescriber must document their medical records in entirety in case something happens to the patient. If there's an overdose, they need to have it completely documented that they obtained consent to take it, and also the prescriber needs to let the patient know all the risk factors of what can happen, not only overdose, but side effects. And a lot of times, if the prescriber is prescribing a high dose or a large quantity of pills, they're required to prescribe Narcan as well in case of an overdose. So, and again, they strongly highlight that all medical records need to be taken in full description in case something happens. According to the Health and Human Services of Rhode Island joined the Opioid Settlement Advisory Committee in 2022, which earned them $90 million of funding that they were able to use for prevention, treatment, recovery. And so of the $90 million, 20% of the funds were distributed to cities and towns based on the population, and then the rest of the money, so the last 80%, that was given to the state to be dispersed to different programs based on necessity. And now that we have talked about the states and regulations, I want to talk about how those regulations are being used within the treatment plans. So, according to Rhode Island's behavioral health care, development, and disability hospitals are part of the Overdose Prevention and Intervention Task Force to create the COE, which is the Rhode Island Centers of Excellence. So these are dispersed all throughout the state, and it's basically a place that offers assessments, access to care, and treatments, and they actually give out medication like methadone, buprenorphine, and naltrexone, which are meds that will effectively help somebody get over an addiction. So these are dispersed all throughout the state: East Bay, Newport, Cranston, Providence, South County. They're everywhere, and the information is easily accessible online. There's also multiple inpatient centers in Rhode Island. I could find some when I Googled it, and they're just places where you can go and stay and talk to people, get prescribed medication, and help start your recovery, and they'll show you the steps that you need to take to recover. While there are treatment options available, and I was able to find some, this also connects to things that I think could be changed within the state to help benefit recovery for people and help lessen the overdose numbers in the state. So while researching access to treatment in Rhode Island, I noticed that there was a lack of Narcan distribution centers, and Narcan saves lives when it comes to opioids, and I personally think that it's something that everybody should carry around, whether you're an everyday person, a healthcare provider, or you know somebody who is taking opioids or who has a history of substance abuse. It can completely save somebody's life, and it completely reverses the effects of the opioid or the opiate that the person's taking. So I noticed that there wasn't a lot of Narcan distribution sites in the state, and I think that, schools should give out, high schools, healthcare centers, primary care providers, and everybody should have easy access to Narcan. There are ways to get it online, but a lot of people don't have access to technology or don't know how to do it. And also a lot of people who are addicted to drugs don't have internet or a place to live or anything like that. So it's not as readily available as it should be. And additionally, I found that substance support groups weren't easily able to be found. I could look up some, but they weren't easily shown on the internet. There was a lot of ads, and they were all hidden in different websites. So I felt like those should be publicized a lot more. And also, a lot of them cost money or required insurance. And like I said before, a lot of people who have substance abuse don't have a place to live or ran out of money, and they just don't have the ability to pay for or have insurance pay for support groups like that. So it would be nice to have free, readily available places for people to go get support. In closing, Rhode Island is continuing to fight the opioid crisis every day, and we must hope that they just keep receiving funding to improve their plan of action. And while the opioid crisis has deeply affected people and their loved ones, we will maybe never see the end of it. And so, there's always ways to help reduce the number and raise more awareness of what people can be doing to help treat it. It is important to keep advocating for it, expanding treatment options, creating more Narcan centers, and, we all have the same goal, and recovery is possible. Everybody has a chance to, and so it's just important that we keep talking about it. Thank you.